I thought about adding some fake facial hair during the break in order to look more like him.
Hi everyone. I think it probably makes sense to make a start. So can I just ask everyone else who's a panelist just to mute your microphone while you're not speaking, so that we don't get any noise interference. Welcome everyone to the second set of parallel sessions for this conference on researching civil society responses to and recovery from COVID-19. This session is the first of two communities and mutual aid sessions. And the focus for this session is going to be around conceptual insights. And tomorrow we'll have some more kind of practical examples of what different projects have been doing. But we've got 5 really interesting and stimulating presentations, kind of looking at all sorts of different angles of how communities and neighbours have responded to the crisis. Without further ado, I'd like to introduce our first speaker, which is Marilyn Taylor, who is at the Institute for Voluntary Action Research, and she's going to share her presentation on locally rooted community organising during the COVID-19 pandemic.
Hello everyone, can you see my screen?
Yes, we can.
Good. So, in 2011, when David Cameron introduced his Big Society, if you remember that, he set up an ambitious 4-year programme to train 5,000 community organisers, which was run by locality. There were also 2 small related programmes to promote social action and community rights. Then in 2017, government funded a further 3-year expansion programme. This was run by community organisers, the new national member-led organisation that developed out of the original programme. It operated through 20 social action hubs, most but not all of which had been involved in the earlier programmes. Mandy Wilson and I had been involved as learning partners throughout the 9 years of these programmes, carrying out a range of research as part of a small team we called Imagine. So when COVID-19 hit, the national organisation asked us to find out how community organising was contributing to the response in local communities, and also what would be needed to support these communities as the initial crisis eased. We carried out a literature review, ran an e-survey of the members of the national organisation, some in the programme, some not, and interviewed a small number of organisers and others in the field. We did the field work in June, published at the beginning of July. The trust we'd been able to establish as learning partners over the years, and our knowledge of the programme helped us move fast. Our ongoing fieldwork for the programme also meant we'd already captured valuable information from earlier unrelated studies in April and May. And we were a bit concerned about organisers being stressed, but we found they really appreciated the opportunities to step back from the fray and reflect with trusted partners on what they were doing. So, what is community organising? The national organisation defines it as the work of bringing people together to take action around their common concerns and overcome social injustice. Community organisers reach out and listen, connect and motivate people to build their collective power to effect change. Key to this is listening on the doorstep and the places where people gather, connecting, bringing people together to share their concerns and generate their own ideas and solutions, building resident power, residents organising to influence wider change. So what did we find out? Organising during lockdown took 5 main forms. First, practical help, the now very familiar tasks of providing food, collecting meds, making sure people weren't isolated and so on. Second, gathering and providing information, running surveys and listening campaigns to find out what local people really needed, getting information out in accessible forms, linking local people with the local agencies that could help them or where these people's own help would be appreciated. Third, connecting residents in and across communities. This entailed moving online at speed, but at the same time tackling digital exclusion and helping people get access to tech. Fourth, influencing policy and practice, where people couldn't resolve problems themselves, working with them to identify who they needed to influence and how to make their case. Fifth, organising at agency level, identifying gaps and duplication, acting as a broker to coordinate action, and sometimes mediating when there were tensions between different agencies. We've heard a lot over recent months, and will do in these 2 days, about the explosion in mutual aid and community spirit. But was there anything distinctive about the community organising approach? And what does this mean for future policy and practice? First, organisers tend to work in poorer and more vulnerable communities, where people's lives were already a struggle before COVID-19 hit. But a long history of community organising meant that local resident networks were already in place to respond really quickly, with a hyper-local knowledge and, most importantly, trust to reach their most vulnerable neighbours. Acorn, for example, is a community union that has worked particularly successfully with private renters over the years. The robust organisational systems it has developed across its branches for its campaigning work meant that it could mobilise its members at high speed to provide the practical help that was needed. In fact, it had such a good response, it also acted as a volunteer bank for other local agencies in the 9 cities where it works. In Stockport, a group of local women who had been trained as community organisers set a wide range of activities in motion. They felt that this crisis was what they'd been training for. In London, an organiser whose community hub was having to furlough staff and close projects down overnight was able to mobilise his trained organisers to reinvent it temporarily as a much-needed food hub. An organiser working with English as a second language classes was able to link vulnerable asylum seekers and refugees together and provide them with information about their rights and sources of crisis support. The positive reputation and trust that many years of organising established also proved its worth at agency level. In most cases, local agencies, including the local authority, saw organisers as a vital route for reaching the most vulnerable people in local communities. This trust also oiled the wheels for the important coordination and brokerage roles that I described earlier. Finally, as well as the work at a hyper-local level, the national organisation was supporting wider networks of members, which acted as a much-needed source of peer support and information, not only for these members, but for others working at the coalface. So, what of the future? The pressures on poorer communities will increase as the country goes deeper into recession. But there's a danger that the community energy is generated during lockdown will dissipate as people go back to work, or indeed as they struggle to survive. Organisers expect mental health to be a huge issue. But there are opportunities too. Going online has been a challenge for organisers used to working face-to-face, but has extended their reach to different parts of their communities. However, online doesn't reach everyone, so continuing to tackle digital exclusion will be a huge priority as more and more mainstream services go online. Then again, the new contacts organisers have made, both on and offline, mean that there are new people waiting to be trained and opportunities for new initiatives. Some organisers thought people were more willing to engage now, and many of our organisers will be carrying out new listening campaigns, knocking on doors when this is appropriate, and finding other ways to ensure that they really know what the concerns and priorities of all parts of the community are, and not just what other people assume. Some want to make the space for difficult conversations. This might mean tackling the fault lines in the community or between local agencies. But one organiser also thought that people were more willing to talk about poverty and mental health issues now, before they were too proud or too ashamed. Other organisers were working with allies to develop wider strategies to tackle the problems and injustices so anger and frustration directions, making sure that people in the most vulnerable places have a voice and are heard. The funding for the programme has come to an end, but what has it taught us about how to ensure that the most vulnerable communities are not left behind in future? We had 4 key messages for funders and policymakers. First, invest in the good times as well as the bad. In these most vulnerable communities, it is long-term, ongoing support that has built the relationships, power, and resourcefulness that has enabled them to move quickly when faced with a crisis. Second, it shouldn't be a privilege to volunteer. Some communities can organise spontaneously, but communities that have been at the sharp end of change and austerity are less likely to have the resources and community infrastructure that is needed, or indeed the confidence. They need investment to play their full part in response and recovery. Third, make space for informality. Organisers recognise the need for structure to harness energies and enthusiasm in the long term, but the immediate community response to COVID-19 has been based on trust and local knowledge, doing things, as David Robinson has put it, that would never be allowed in the volunteer manual, unencumbered by forms and conditions. Funders and partners need to continue to allow for that flexibility. And finally, putting residents at the forefront means taking risks. If residents are to lead, then outcomes just cannot be specified in advance by outsiders. Funders and partners need to be prepared to evolve and to learn alongside them. Thank you.
Thank you, Marilyn. Really kind of thought-provoking presentation to kick us off there. I think I forgot to mention at the beginning, we're going to take questions at the end. So if people who are with us want to put their questions in the Q&A box, we'll make sure we look at those and then allow time for discussion at the end. Our next presenters are Michele Biddle and Matt Jones from the University of West of England, who are going to talk about their presentation Apart But Not Alone, which is a cross-sectional study of neighbour support in one UK area during the lockdown period. So
Thanks, Chris. Good afternoon. So Matt and I represent a bigger team of researchers from UWE's Centre for Public Health and Wellbeing. Myself and a couple of others are also affiliated with the NIHR Applied Research Collaboration West. On this project, we partnered with community researchers from Bristol Aging Better, as well as public contributors from People in Health West of England. So evidence from a range of major public health incidents shows that neighbour-based action can have a critical role in response to crisis and emergency situations. When the UK went to lockdown on the 23rd of March, we became aware that mutual aid and community support groups were springing up rapidly across Bristol and beyond on a range of social media platforms, including WhatsApp, Facebook, Nextdoor, which is a hyperlocal version of Facebook, as well as through street level. We recognized the potential for an important piece of research that could be undertaken to capture what was going on, but we needed to act quickly. So that's when we embarked on on a 3-phase project, which we called Apart But Not Alone. This slide shows you the 3 phases and the research questions for each. Our study area was focused mainly on the Bristol built-up area as defined by the Office for National Statistics. So this covers all of Bristol, most of South Gloucestershire, and the urban fringe of North Somerset. We launched Survey 1 about 2 weeks after the lockdown started. And this survey was done on Qualtrics, so as an online survey, was directed at those who were giving some form of support to their neighbours during the initial period of lockdown. This survey was promoted through several channels, including 19 postcode-based Facebook mutual aid groups, coronavirus community and voluntary sector support groups for older people, Black and Asian minority ethnic groups, support groups, disability support organizations, a social housing action group, and the local health watch. Respondents were asked for their postcodes so that we could track where support might be lacking. We also asked respondents to provide us with their email address if they were happy to be contacted again, so we could find out how they in their neighborhood were getting on. And we used these email addresses for phase 2 and phase 3 of the study. For phase 2, these were qualitative telephone interviews, and we used a maximum variation purposive sampling strategy aimed at to select participants from across a range of deprivation areas, ethnicities, ages, and genders. Survey 2 was launched about 2 weeks after the Prime Minister announced easing of lockdown restrictions. That was on the 10th of May. So this timeline gives you an idea of how rapidly the project progressed in order to capture what was going on in neighborhoods. At present, we are still analyzing and writing up findings from phases 2 and 3. As you can see, the numbers of those who completed the surveys and how many, and we did 20 interviews as well in phase 2. I will now hand over the time to my colleague Matt, who will present the findings from this study.
Thank you, Michele. So I'm going to just cover some of the key themes emerging from the study without going into all the blow-by-blow statistical details and so forth. I'm going to cover a number of themes. First of all, right at the beginning, one of the big themes that we were interested in was that around everyone being involved. Firstly, many people, including the older people, those were shielding, were describing how they were very actively supporting their neighbours, even if this was forms of advice or moral support for those who are giving it, who are unable to leave their homes. And it presents a somewhat different perspective from other reporting that tends to present these groups as being the passive recipients during the crisis. So we got a lot of evidence of them being active and taking a very proactive role at the neighbourhood level. People were doing things quickly, and the people taking part in surveys described a feeling of an ability to act very quickly, in contrast to the major voluntary sector and public agencies. And there was quite actually a level of self-awareness about safeguarding and other risk-based issues. So the sorts of people that we were coming back to us were aware about the risks, but were also talking about the need to act fast. All manner of support came under this umbrella of what we were looking at as neighbourhood support, and that ranged from the very formal stuff, the medical assistance and the prescriptions and so forth, but blended in very much with the humour, the comedy, the small acts of kindness, and that very integrated ways in which one thing blurs into another was, I think, one of the interesting things that came through at this point. Also, I guess we can all think back to that kind of quite frenetic point where there was a huge amount of different channels through which people were reporting the ways in which they were contacting their neighbours, often using quite creative routes of blanket leafleting and notices and so forth. But of course, the explosion, particularly of WhatsApp, was one of the biggest features that emerged. And also the interesting cross connections across different political interests groups, faith-based organisations, neighbourhood forums and so forth, cross-cutting, people who wouldn't have gone outside of their bunkers ordinarily. There was also, we did statistical analyses of the patterns of support, and that showed that areas of higher social deprivation were reporting higher levels of needing to support around issues of disability, reduced mobility, people who lacked outdoor space or were in financial difficulties. Okay, Michele. With regard to the interviews, we were interested a lot in about the way that how people thought about what neighbour support meant, and that linked very much with people's sense of identity. One of the majority of the people who responded and took part in our research were women, and there was clearly quite a normative influence around constructing what was meant by support, and how that was filtered through different ideas of roles and what was appropriate and so forth. Is also the interviews captured a very intense sense of belongingness within the community, and about how that most mobilized action. But there's also, people talked a lot about major forms of dislocation in the area in which they lived as well, around the heightened sense of fracturing, often around ethnic, gender or class-based lines.
That's just 2 minutes.
It was very liminal. It was a very marginal time where things were possible, but might not ordinarily be possible. So that was an interesting feature as well. Next slide, please, Michele. Towards the end of the period of lockdown, what was interesting were people talking about all kinds of new connections, which were very likely to be hard to unform going into the future. That no going back theme was an interesting one then that we found, where people were talking about it being hard to, the irreversible changes that had taken place. Even though people also talked about all forms, a range of forms of fatigue, discontents about rule breaking, over-the-top behaviour, a loss of solidarity, and a lot of grievances around the limitations of social media. Overall then, towards the end of the lockdown period, a lot of that neighbourhood support was melded with feelings about where was the state coming into this position, what was the appropriate for people to be doing, and where were the boundaries around what could and could not be done. Over to you, Michele.
For sake of time, I'll just skip over. There was just a couple of articles in The Guardian, and then this BBC report sort of resonates with what we found in survey 2. So interesting intersections exist between informal neighbour support and more formal action of voluntary and statutory sectors. Informal neighbour support is likely to both complement and enhance the actions of formal agencies and form an important basis for transition and recovery from the pandemic. There's this, and this resonates with the Financial Times article published, and researchers need to more fully understand these intersections. So if you're interested in reading findings from our survey 1 has been published in Emerald Open Research, and you can follow us on Twitter at Part Alone to find out updates on this study. Thank you for listening.
Brilliant. Thanks again for a really thought-provoking presentation. Our next presenter is Cathy Hynds from Volunteer Scotland, who's going to talk about how we might learn from international emergency responses to COVID-19, particularly in the Scottish context. Cathy, you need to turn your mic, unmute yourself.
Sorry, thank you. This is very much a sponsored personal reflection after returning from almost 15 years working in international aid. And the first 2 slides summarises key learnings that's come out of analysis of aid efforts over the last 10, 20 years within particular. The first is that if you're responding to a crisis such as COVID-19, that is efforts need to be put to address vulnerabilities as well as looking to reduce exposure to the hazard. And there's two reasons for this. First, the most vulnerable are found to be most adversely affected by any crisis in that, and secondly, the scale of the disaster, the scale of the damage done increases unless you are tackling the most vulnerable. The second learning is the creation of a resilience framework to guide responses to a crisis. Now, this is a very much deliberate move away from the kind of sequential approach that would see the more emergency humanitarian response being the first phase, that would then be followed by community development efforts that would belong to the recovery phase. Unfortunately, it was found that the clear line between the two wasn't found, and as such, it tended to be an over-reliance on the humanitarian emergency response, which actually led to a worsening situation. So in this resilience framework, it describes 3 types of capacities that should be looked at and addressed, and efforts made to address each of these capacities from the very beginning. So in your absorptive capacity, you've got your basic human needs. This is your provision of food, your aid response. Your adaptive capacity is looking at ways to prevent people becoming food insecure, for example. How people can change practices and make informed decisions in order to recover from the shock. The third capacity is your system change. This is your policy inputs that would sustain resilient efforts over the kind of prolonged time. So the results presented here are very much a desk-based analysis of the COVID-19 response in Scotland. And I'm asking 2 quick questions. How does it shape in regard to the resilience framework? Secondly is, does it reach the most vulnerable? The Ipsos Mori survey data looks at the type of activities volunteers have done, and you can see that most of it is very much absorptive. It is your provision of food, either by shopping or provision of meals, befriending, household tasks, and specifically the mutual aid groups and informal volunteer systems. They've got a much higher percentage of doing the absorptive capacity building only. It is your formal volunteer sector, those working with charities, that are most likely to be doing the adaptive ones, the preventative solutions. Secondly, what is found is that most of the efforts is actually in the least deprived areas. So obviously that affects the second question is, are the most vulnerable being targeted. However, interestingly, for the informal volunteer response, that's got a high percentage that are in the most deprived areas. So it would appear as though most are only meeting at absorptive capacity only. The second question is, are they reaching the most vulnerable? The Scottish Government has identified these three groups, 4 groups, as being the most vulnerable. And it's already shown that these groups have already begun to be adversely affected by COVID and are not benefiting from the mitigating measures in place, such as the furloughing scheme. So it's then kind of asking the question of the types of volunteerism, are they reaching these vulnerable groups? Mutual aid groups, hypothesis is that they are not. They are mainly reaching the ones who are shielding. They're also using digital communication, which tends to exclude those who are low earners who don't have access to internet. And also, as you would imagine, the mutual aid groups and informal volunteering, they may not know who is the most vulnerable. Formal volunteering is the group that's most likely to have been involved in targeted support. They knew who the most vulnerable were pre-COVID, so had the potential to be able to carry on responses in an adaptive capacity building way. However, as has been quite well documented, the formal sector has been the most impacted by both social distancing with COVID, but also the financial threat that they are facing with the economic downturn. What is a concern is that for most of the formal charities, for instance, they have had to modify half of what they do. Sadly, they are reverting to giving food aid rather than the detailed work that they were doing in mental health, for instance. So from a resilience perspective, they are going back to only addressing the immediate aid. Community
just 2 minutes, Cathy.
Yeah, are the most impacted, and they've had to stop half of what they are doing. And the future is far from certain for those groups. Interestingly, the third sector is already expressing concern about deteriorating mental health and increased poverty. So the question becomes, is there a place for kind of mutual aid and informal volunteering in the resilience framework? I and other research would suggest yes, but only if it's part of a coordinated effort. If you've got part of a coordinated effort under local authorities, more chance to know who is the most vulnerable and to be able to do the appropriate signposting and training. Secondly, the current resilience strategy that is in place by the Scottish Government, if I would compare that with what is usually in place on an international level, it's quite weak. So I would suggest that there needs to be improved guidance on that strategy and improved resources to translate that into meaningful plans at a local authority area. Secondly, needs to be increased funding and priority based on the preventative measures. And arching these, there needs to be much better signposting. That's it. These are the references that I've used. Thank you.
Brilliant. Thanks, Cathy. Thanks a lot. So our fourth speakers, I should say, we've got a triple act on the way, is looking at from Kropotkin to COVID-19, the role of mutual aid associations in democratic participation. And we've got Jurgen Grotz, Michael Locke and Michael Ashe presenting together with this one.
Okay, thanks, Chris. I'm Mike Locke. This is a study of that we're just getting going, really, focusing on mutual aid groups in Kensington and Chelsea. The groups that have been created to help people during the pandemic, as colleagues have recognised, of course, in these presentations. It comes out of our involvement in Kensington and Chelsea. Michael Ashe is the CEO for the Volunteer Centre in Kensington and Chelsea. I'm Vice Chair of the board for the Volunteer Centre, and we're working with Jurgen at the Institute for Volunteering Research to frame this study. And I should also say I'm on the advisory panel at IVAR, so it's quite a close-knit group of us working on this project. And really our starting point is just to introduce ourselves, I mean, for me, it was the kind of curiosity about where does this idea of mutual aid come from, and of course, where's it leading? Mutual aid as a term hasn't really been a major part of our discourse in the voluntary and community sector and in volunteering. I mean, the words have been there, but not a major theme, as it were. And then suddenly, in the middle of March, everybody, well, not quite, is talking about mutual aid. I noticed that on the 16th of March, it was 2020, a newly organised national website to give advice to mutual aid groups and to help people find mutual aid groups. On that date, they issued a press release saying there were more than 200 mutual aid groups across the country. The same date, 16th of March, a social media posting in Kensington and Chelsea set up 8 mutual aid groups across the borough based on council wards. And suddenly things were coalescing around this idea of mutual aid. So I think, first of all, what we're asking is what is it that brought people together? I mean, was it just, as it were, a simple wish to help people and to get on and do things? Or was it for some people a way of an opportunity, really, to create a more inclusive society? What ideas were shaping their actions? And how do their actions and their aspirations for their groups and activities relate to the state and to the voluntary and community sector as a whole? I mean, are these perhaps, these groups, are they charities in embryo? Or are they perhaps a counterforce to the mainstream of the voluntary and community sector? And probably all these ideas are involved somehow. And we think it's particularly important because we notice, such as through the Greater London Assembly, the new local government network, and hints from the DCMS, that local and national government are sort of wondering how far mutual aid groups can be brought into partnerships and networks with local government for social care from now on, and of course in preparation for the next crisis. So our hope is to disentangle some of the ideas and the ideologies in the idea of mutual aid. It's going to lead into asking about global perspectives and ideological basis, and we're doing that by focusing here on Kensington and Chelsea. Working with Jurgen, we've developed a small-scale local study which is focusing on the experience of people who've been involved, including ourselves. So there'll be a participant observation approach, basically, with key figures from groups and the borough networks, health and local authority, surveys, workshops, and interviews with stakeholders. And backing that up with a discourse and analysis of the policy documentation and literature of mutual aid, which is going to take us back to Kropotkin, 1902, the kind of the groundwork for anarchist theory, but also to Beveridge and the social democratic approach espoused in his book on voluntary action. But as you notice here, we're only just getting going. We got ethics approved on the 19th of August. But can I now hand over to Michael, who's going to tell us how it seems to him?
Thanks, Mike. Some context first. So Kensington and Chelsea that we'll be studying is one of the smallest and most densely populated districts in the UK, and also the most unequal in terms of income. People in North Kensington are twice as likely to die before 75 as those who live in Chelsea, barely a mile distant, which has the highest life expectancy rates in the UK. In addition to the first volunteer centre, Kensington and Chelsea is home to the first CVS and the first law centre in the country. And as one of the few councils that's continued to grant fund local charities at scale, local civil society organisations in the borough remain relatively diverse, numerous and collaborative. The borough has a history of popular emergencies. So racial discrimination by the police, landlords and others helped to birth the Notting Hill Carnival, one of the biggest community-led street festivals in the world, and the community response to the Grenfell Tower fire in 2017. And the state policies that necessitated that response continue to receive global attention. The Volunteer Centre began helping people give their time through local public benefit organisations in 1969. As we became aware that some groups of local people face structural barriers to volunteering, self-development and participation in civil society, so projects were created to respond to that. In addition to brokerage and organisational development, today we have programmes that work with disabled people and their carers, people experiencing long-term unemployment, those living with criminal record, addiction or persistent mental ill health, and those living on the estates most affected by the Grenfell Tower fire. Having spent a couple of weeks trying to think through the implications of the distressingly delayed lockdown that was surely coming, and a couple of days working with colleagues at the Volunteer Centre and our partners to gear up for what we thought local people would need in terms of food, medicines, emotional support and otherwise, when lockdown did arrive, on Saturday the 14th of March, I joined the mutual aid group in Kensington and Chelsea. This meant signing up to a WhatsApp group that linked me to a few dozen other people in what was clearly an exponentially growing network. Over the following couple of days, I realised that some of the people in that network were people I worked with already, but whose WhatsApp handles didn't make that clear to me. Some were strangers who I would come to trust completely over a very short period of time. And some were there to co-opt the people and energy for their own purposes, or indeed to make a profit from them. I first heard that a mutual aid network was growing across London to take direct action in response to COVID-19 via another WhatsApp group, South West London Socialists for Labour. I've long been interested in the anarcho-communist thread that includes Kropotkin's mutual aid, and I was delighted to see a network of apparently self-organising local groups springing up, digitally connected and sharing questions and answers. At its height, mutual aid KNC had around 1,600 participants, many of whom had no experience of formal volunteering. Alongside pre-pandemic networks like Nextdoor, groups formed in 2017 in response to Grenfell, and those of an older vintage. My experience of the first 21 days was of huge professional and personal productivity, stress, achievement, and development. The gap between governmental guidance and the onrushing virus meant that when we and our partners in Age UK, KNC, and Kensington and Chelsea Social Council, the local CVS, began suspending face-to-face services and assembling an emergency food coalition of local community organisations, some statutory colleagues were quietly delighted and relieved. This early leadership from civil society translated quickly into the first meeting of what would become the Community Resilience Group, chaired at our request by our Director of Public Health, backed by the Director of Mental Health from our local clinical commissioning group.
Just 2 minutes.
By chance, a local activist had been invited to the meeting, who was also a member of mutual aid, and that had serious consequences over the next few weeks. First, it helped to ensure self-organised volunteering would be at the heart of the community response. It also facilitated the development of trust, and so the integration of mutual aid with the formal voluntary sector and with key actors in the statutory agencies. And it nurtured the principle that information, ideas and resources coming in from local people were as important as those coming from the local authority, the NHS or the voluntary sector. We think these points were critical, as in the third week, local politicians sought to delegitimise mutual aid as dependent on which party they were members of, either unelected or not of the community. This attempt was ultimately unsuccessful, but did divert time, energy and resources away from the community response and reduced trust. Other developments during that period included that the 8 zones created within Kensington and Chelsea by mutual aid included one that immediately seceded and declared that mutual aid itself in Kensington and Chelsea didn't exist. The setting up of a food parcel service, the development of a single point of contact for shopping and support by mutual aid, around 2,000 offers of new volunteers, most of whom in the formal sector we couldn't accommodate for the reasons that have been given in previous presentations, and the creation of a weekly meeting in which volunteers of all kinds, including people who might not see themselves as volunteers, could meet and exchange ideas. Our research will explore this rich field, the first phase of the pandemic and the community's response to it, to ask what parallels can be drawn from previous mobilisations in emergencies, as well as with volunteering in peacetime, and what the experience might mean for democracy and participation in a time of economic crisis and political uncertainty. Are these networks an unexpected or expected manifestation of the deeply social species Kropotkin described in 1902, shooting towards the brief light let in by a breakdown of state and commercial systems, or are they something else? Thanks.
Brilliant, thanks everyone. So moving on now to our final presentation, which again is on mutual aid, drawing on the Scottish example, and we've got Jack Rendall who's going to present. Just make sure you've got your microphone unmuted.
Yeah, thanks very much. Minimize you all. Okay, hello, I am Jack Rendall. I'm a researcher at Glasgow Caledonian University, presenting this on behalf of my other colleagues, Maeve, Curtin, another researcher that's been working with me, and then our PI and co-I of Professor Michael Roy and Professor Simon Teasdale. This was a piece of research that is funded by the Chief Scientist's Office from the Scottish Government, and they're particularly interested in the interaction of mutual aid groups with the formal service providers within Scotland. So you can see down here, I've got some of the pictures that we've collected through our research, which I'll go into a bit more about. So just to give you a background, we're approaching this as understanding the mutual aid groups as kind of grassroots community responses to what we would maybe call them non-obvious ways to or interventions to help prevent infection. And it's a way of doing this by supporting communities, which can then help to stop the spread of transmission, or at least reduce the effects that people are feeling from being locked down. So these organisations or groups act outside of the remit and coordination of the formal health systems, organised by public authorities, local authorities, and indeed any centralised authority at all. So this brought us to the research question about how and in what ways do mutual aid groups complement, enhance or undermine formal public health provision in the context of the pandemic. So just a little bit about our methodology. You won't be surprised to find out that we didn't do face-to-face interviews with individuals. This is a purely kind of digital approach to collecting everything that we needed, but it was also an ethnographic approach as well, in that we were trying to understand individuals' perspectives of how they were interacting both with the group itself and then how the group were interacting with the formal health services as well. So to do this, we used a platform, an online platform called Recollective. I'm just mentioning it here. We're not on commission or anything, but I just, it's useful to find out about these things, especially since future research might be mostly digital for the foreseeable future anyway. And this helped us to record observations, ignite online discussions as well. I was able to provide activities, and we were able to do one-to-one interviews through this too. So we were focused on 3 different mutual aid groups across rural, peri-urban and urban Scotland. There were kind of a variety of different deprivation areas as well. So we had one of the most deprived areas in Scotland, and then one of the more sort of thriving areas as well. And then what we're hoping to do in the near future then is supplement our findings with a focus group involving public health professionals themselves and understanding what their perspectives of interacting with these groups have been, at least across these 3 different areas. So to go in depth on just on the right hand side of your screen here, these are some of the activities that we set up for our participants. Within each of these activities is a series of tasks that they can go about filling in. So we had a welcome activity, for example, that had a few tasks in it, getting them to outline their role in the organisation, their background, how they got into it, their perspectives on if they consider themselves a volunteer or not. I see we've already had a question about whether we should consider these individual members of the mutual aid groups as volunteers or not. So trying to understand a bit more about what their role is and what they see their role is. And then just to pick out another one, the ongoing journal impact examples allowed us to get a almost day-to-day approach to how an individual might go about in delivering a prescription to an individual from the time that they contact the mutual aid group all the way through to delivery at their door and understanding that whole process. So we also then were able to do one-to-one interviews with our participants. And the nice thing about this is that we had some automatic transcription linked in with this online platform too. So that saved a lot of time. So just to get into the findings then, I refer back to our research question, trying to understand how it complements, enhances or undermines. First of all, in terms of complementing, we have a few things here. First of all, I think that are repeated from what we've seen in our discussions just before. So I'm quite glad that we have some of the things that are mirrored and echoed in what we've heard so far. But hopefully you'll be able to understand some different perspectives here too. So in terms of complementing, we consider this as contributing extra features over and above what the formal public health provisions have been provided already. So these are things that have been touched on already, which I won't go into too much detail about. Delivering services in terms of food, both from collecting from grocers, supermarkets, but also food banks as well. And then prescriptions, which was such a key part from the 3 different mutual aid groups that we were involved in. And it seems to have been something I think that it could be enhanced for the future, at least in terms of delivering prescriptions, obviously, because people that are shielding tend to be on more medication than those that wouldn't be shielding. So it's still an area that I think we need to look into with urgency. The provision for non-shielding as well, so this might counteract some of the things that have just been presented to, but we found that, at least in a couple of examples, the coronavirus community support hubs that were set up by the local council, they started turning people away for those that weren't on the shielding list, because if we think about shielding as just being calculated as the risk to the virus, it doesn't mean that the individual that isn't on the shielding list still isn't vulnerable to the responses and the risks that come along with the pandemic itself. So we've had people that have been turned on to the mutual aid group that aren't on the shielding list from local councils to deal with some of the issues they have. We've also heard today about the quick responses that have come about through the mutual aid groups and their flexibility in being able to do that. We've had a kind of lead time across our mutual aid groups. They've said in about 2 weeks' time, before any of the formal public health provision was set up, the mutual aid groups were responding, and then 2 weeks later, the changes would happen in the more formal services as well. If we think about enhancing things, so that's increasing the effectiveness of the features that are already existing in the community. So these are things like pulling resources together, linking organisations. In Inverclyde, for example, where one of our groups was based, we were able to understand how they brought existing third sector organisations together and hopefully be something that's better than the sum of their parts. Information sharing, so the information that was coming out from things like the NHS on the number of infections in the local area and spreading that out widely could have a potential impact on helping to reduce the transmission rates. Number of volunteers was something that we understood as an interaction between, for example, third sector organisations that didn't quite have the manpower to be able to deliver what they were wanting to deliver to individuals that were contacting them. So sometimes we'd have the council or these organisations get in touch with the mutual aid group to try and use their army of volunteers or members, whatever they deem themselves as, to be able to carry out the service. Again, we've heard about local knowledge earlier. And we've had examples of the local council phoning up mutual aid groups to specific members to try and understand. We've got a woman that we know is vulnerable, but we don't know how to get somebody to go and put her bins out, or just these kind of smaller local knowledge things to know where the house is, for example. And then just a couple of points on undermining. So that's lessening the effectiveness of the existing features that are in place already. We've kind of heard about these previously as well, about the lack of long-term security. So if you have somebody in a mutual aid group that is being delivered food weekly and they start to rely upon this service as the lockdown continues, or even as it eases, what is the long-term approach for the mutual aid group in being able to sustain that delivery? Do they pass that service on to another organisation, or do they try and continue it themselves? Then there's also, as we've heard about, an exposure to risk here too, about risk of information sharing, but also exposure to being able to not transmit the virus too. So we're definitely still in the analysis stage for this. We've got some further findings that we have started to explore as well, and they're starting to come out of the data that we have. So we have a little bit of information on the volunteer demographics, the type of people that are volunteering in these organisations, or at least being members of the group where they're accepting help, but they're also asking for help as well. We have a consideration that the mutual aid groups are less formal too, which is a sort of, I'm starting to understand mutual aid groups almost as a faceless organisation, where individuals, we've had reports and perspectives from our participants that have said individuals contact them because this organisation doesn't have any sort of attachment to any judgment from the community. So perhaps if you got a delivery from the food bank and somebody saw that, they might be concerned about that. But for mutual aid groups, it's almost just like phoning a neighbour. We also had perspectives that the mutual aid groups tackle the low level activities, but sometimes it's the low level activities that can have a big impact. And I'm sure we've all experienced this during lockdown, where some of the small things just going slightly wrong can have a big impact on your day and sort of the well-being of you and your family. So some of these little things were like delivering ketchup to a single mum who had no neighbours to help her out, and her boy wouldn't eat anything without any ketchup. So she didn't want to phone the local council community virus response team to deal with this issue. It was almost just like phoning a neighbour, and somebody was able to deliver that, and it just helped her family for that night. So just small examples like that. I've mentioned information gathering and sharing. I think that's particularly important. I spoke to a woman that had a list of 50 different individuals and all their prescriptions and their addresses and their names. So how information is gathered and shared amongst the different members of the mutual aid group is something that we're exploring a bit further and seeing if there's any lessons we can learn from that, especially in GDPR days. The online presence is another thing that we're wanting to explore a bit more. Obviously, everything's based online and what that does for access for some members, but also how they interact online. And we've made a timeline of the amount of posts at the start. Some of these groups had 3,000, 2,500 members, and it's whittled down to maybe just a couple of posts a day now, with very little interaction on those posts. Then the future of groups, as I've said, the sustainability of that, we're starting to uncover as the lockdown is eased. Some of them are going into hibernation, and some of them are changing form entirely. So we're hoping to explore that a bit more. Just a little bit more on further analysis then, we also have, this is one of our tasks, and being able to rate different parts of the formal health service provision, and indeed just the local community in general. So you can see here, like,
there's just a couple of minutes left, thanks.
Yeah, cool, thank you. We can see here things like local council being somewhat unhelpful in getting their perspectives on that. One of the nice things of these tasks is that we could probe these in the interviews themselves. We already had half the data here. It was just a case of probing, well, what do you mean by risk? Or, you know, what do you even mean by mutual aid groups? Implications then, so we're hoping that the research will be able to increase the understanding of the role of mutual aid responses in the crisis, in mitigating the direct and indirect impacts, their activities, and how they relate to and complement those of the statutory bodies. And then we're hopefully wanting to write a Freedom Press article as well, which can help communities and policymakers, as well as hopefully producing some journal articles out of this as well, spread the word. So thanks very much for listening. I'll be happy to take any questions afterwards.
thanks again for a really stimulating presentation, and already seeing lots of synergies between what we're hearing. Can also thank everyone for keeping to time, because all that means is what we've got now is half an hour where we can hopefully kind of build on what everyone has presented and have some discussion and debate. So I think Véronique has been having a look at what people have been posting. I don't know if you've got some questions for the panel, Véronique.
Yes. There are some very specific questions that are actually addressed at specific speakers that I could start off with, and I think there are quite a lot of questions / comments on definitions and the relationship between mutual aid, volunteering, and charity, which I think I'll leave in second. So I'm going to start off with a question for Marilyn. Marilyn, do you feel the experience of the community organisers project could provide a useful base for furthering mutual aid? And if so, how do you see the main structural and ethical differences being addressed?
Right. I'm trying to sort of second guess what the structural and ethical differences are, but I think one complementary area is the role of organising in extending reach, because there's always a big question of who is the community, who's included, who's not included. And I think organising, training people as organisers helps them to think about power, helps them to think about how to organise, how to include, how to negotiate, all those things. So, and it will help maintain, and the point has been made about how to keep this going. It would also help maintain activity and see the potential for extending it. So I'm aware that at least one of our hubs didn't, the group of neighbours did not want to become a mutual aid group because they saw it as too formal. And they wanted to maintain their informality. So I think there's a lot of room for mutual exploration, and I think it was Craig who answered the question. If he goes onto the community organisers website, he could contact them and have a conversation with them about how that might help.
Good. Thank you, Marilyn. So another specific question, this time for Cathy, which was about, so the question was, what contact strategy did you find most effective in reaching the extremely vulnerable? Did you engage with supermarkets to procure food delivery? And what was the most effective approach? How long do voluntary groups need in terms of lead in time in order to scale up? So quite a few questions for you, Cathy.
Yes, and they are difficult for me to answer specifically because what I looked at was learnings from an international context. So the targeting procedures there would be different than here. What my assumption is that the formal charity sectors here, because they had already been working with those who are the most vulnerable, the low earners, the kind of errors, they had recognized that group as being the most vulnerable. They have been signposted to those people. So that would be the targeting that would occur in Scotland. On an international level, there is much more dialogue with the community involved, and it is one of the most difficult issues going. The second question is about food. I think the kind of important question from a resilience perspective would be that if you are going to give food, and that is good, that is part of resilient response, you also have to be looking at the issues that has caused the food insecurity within the first place, and look to address the O's. And all that should occur at the same time. Because if you wait, you're never preventing people from becoming food insecure, and you're almost trapping them. So in the UK, that is very much income induced. So employability support to help people find better jobs would also would be a type of a adaptive response. I don't know if that answers your questions.
It's hard to know with this system if it does, because the attendees can't actually speak out. But yes, I think it does, Cathy. I do have one more practical question, and this time it's for everybody, but it is quite practical. So what are the practical steps that organisations or groups can take to allow a flexible approach to volunteer recruitment, i.e. how can we continue to get people involved without all the paperwork that safeguards organisation? Does this require a change of legislation? I don't know who would like to go for that one. It seems as though several of you could have a go.
Looks like Mike Ashe wants to answer.
I'll give one answer at least, which is from experience in Kensington and Chelsea, and to take the point that's been made in the chat as well. People in mutual aid don't necessarily see themselves as volunteers, and I don't necessarily see them as volunteers. And people in informal volunteering networks don't necessarily see themselves in the same way as formal volunteers. And actually that was, despite the pressure that came on us in particular from local councillors and from one or two others, that was actually definitely an advantage during the pandemic, the early days of the pandemic response, because although we provided, with support from the local authority safeguarding lead, extensive kind of good practice advice to people, which they desperately wanted about safeguarding, we absolutely pushed back very hard on things like DBS and said, look, you know, these people are basically being neighbours to each other. I think, was it Jack who was talking about that neighbourliness? Why do we want to bureaucratise very basic human support for each other, particularly at a neighbourhood level, in the face of some local councillors, for example, saying that everybody who wanted to help a neighbour had to be registered in some central database? From somebody from a more libertarian tradition, that it was just horrifying thought. It was in some ways more horrifying that was a Labour councillor who was suggesting that. So I think what we valued, it didn't last out the entire pandemic. DBS and more formality crept in steadily, but it was very, very valuable while it lasted, I think.
Does anybody else want to chip in?
Yes. Sorry, can I chip in there? And then Marilyn, I can see as well. I think it does raise questions for volunteer management and some of the good practice that we've been building up over time. And the question I guess we have to focus in a volunteer management way is how far that's about a kind of sort of adapting the management, the guidance that you give in good practice, and how far there are the experience of people just getting on and doing it should be taken as a way of guiding what happens in future. I mean, what Michael said has happened in Kensington and Chelsea is a really important experience, but at the same time, it's kind of like, even I think there was a mention in an earlier session about kind of some sort of on speaking to people on the phone, but it doesn't mean that people, you know, don't need to be safeguarded in a phone call either. So there are, it's a more complex question, but I think it does throw up the questions we've got to answer. Yes,
I mean, it is obviously a balancing act, and I don't need to add to what Mike has just said, but I do remember one of our organisers talking about local people who'd set up a sort of food depot outside their house, and the council was saying to them, well, how do you make sure it's not exploited? And they said, well, A, we know our neighbours, which is Mike's point as well, and B, it's owned by the community, so they're less likely to want to exploit it. So.
Oh, Mike, I think you're on mute, so we can't hear you.
Oh, sorry. Okay. Yeah, thanks. And reading around the project, I've been reading the experience of community organisers and volunteers adopting a more anarchist tradition in the wake of the Hurricane Katrina disaster in the United States. And one of the things that community organisers and volunteers and had to do was to actually help people resist state forces who were kind of trying to shut down some opportunities for help. I don't think that's been a problem here, though I take Marilyn's example just then, but it's kind of one of the kind of complex issues that might be involved.
Does anybody else want to come in on that question? Yeah, Matt?
I only wanted to add that based upon what a lot of people were telling us in our survey was that there seems to be a very strong level of general sort of popular discourse around safeguarding issues. And so people who are wanting to make small community contributions, they're never too far away from a discussion about these things, seems to be the impression that we got. So I think the percolation of safeguarding as a thing to think about, for example, is something really important to bear in mind when voluntary sector agencies are working on those boundaries.
I would maybe just add in my point of view as well. I mean, it's kind of making me think, like, when do you start to say that the 14-year-old brother and sister that are selling lemonade on the corner should have a license for what they're doing? I mean, is it going to cause harm for the community? I think levels of bureaucracy at that kind of level start to impact upon the level of trust in a community. And I think it's partly some of that it's maybe a bit anarchist to say, but that has diluted our social capital linking against one another and being able to understand safeguard as a community as opposed to letting the legislation safeguard for us.
Yeah, I think Mike Ashe has got another point to make.
It's one that stuck with me from what the by-borough, so we're with Westminster in a by-borough structure where we are, what the by-borough lead for safeguarding said at a presentation about when she was being asked about safeguarding and the risks posed by neighbourliness, and she said, I rarely get a safeguarding referral or asked to get involved in a safeguarding issue between neighbours. I often get asked to get involved in serious safeguarding issues where a care home worker who's DBS'd up to their eyeballs and has gone through safer recruitment and so on and so forth, has shown that they are a risk to the people they care for. And while she wasn't trying to problematize being a care worker, she was just saying safeguarding, the bulk of where safety comes from in the community, to take Jack's point, is trust and understanding of each other, not knowing each other. And that you can only replace that with some kind of security structure to a very limited extent. And that's not to say that, you know, there are times when that extra level is needed. But in fact, if anything, she was saying what she wanted to do during the pandemic was to emphasize all of the relational aspects of safeguarding and to play down the kind of more structural and bureaucratic elements. And as I say, that push didn't come from, the push for more bureaucracy didn't come from her. It didn't come from DBS nationally. It came from local actors who felt, I think, principally threatened by the alternative power of community organising and of neighbours speaking to neighbours and doing for themselves, because it disintermediates organisations and actors, and that's something that's really, I think, worth investigating for the future, because you can see that there's more of that to come.
There are a few more questions that I can ask if I may now. Is that all right, Chris?
Yeah, go for it.
So actually it links quite nicely with what's just been said. Somebody would like to hear about the contribution of trust, reputation and mutual understanding within and between mutual aid groups. How were these things nurtured pre-COVID, and how will they help sustain solidarity and support over future months? And what about their ability and willingness to address existing social inequalities and community divisions? Again, quite a big question.
Does anyone want to have a go at that? How essentially we're asking here about how are these mutual aid groups relating to each other? I think is the core of the question, isn't it? Go on then. I think Michael Ashe wants to have a go at that one.
Sorry, you need to stop me if you don't want me to talk. Yeah, the local case study that I'm involved in, people, particularly actually in the local authority, asked if we would convene a cross network meeting just to see if people wanted to connect with each other, despite the fact that they were obviously busy with very practical stuff in the pandemic, and many people felt under a lot of psychological pressure. And when after about week 5, I think something like that, week 4 or week 5, that first meeting was convened, bringing together people who saw themselves as in a capital M, capital A mutual aid network, people in next door, people who were in various kinds of other volunteers, not particularly linked to individual charities, and then 1 or 2 formal volunteers. It was an immediate, huge success. And actually what's happened is that the local authority has then attempted to co-opt that group longer term, because they felt that it was immediately much more effective at reaching the community and understanding the community than millions of pounds worth and years of engagement, formal engagement activity. And I think that tells many, many different stories about what the people in these new and emerging networks wanted, what residents in general want, how, if you give them the chance without rules and power structures, ordinary people quickly make up sets of rules that facilitate effective and efficient collaboration, and that people in our networks, they definitely didn't want to take over the function of the state. There weren't many anarchists or libertarians in there, not hardened ideologues. Mostly they wanted the state to do what they thought its job was, and at the margins, where that wasn't happening, they wanted to do for each other while they were waiting for the cavalry to show up, I guess.
Marilyn.
I think I just want to say about the contact between mutual aid groups is a bit of caution that the huge diversity in terms of those groups, in terms of the biographies of the organisers, the particular networks that they are tapping in previously, and it makes me feel a little bit cautious about some which are clearly, the Daily Mail Women's Institute kind of readers, and then another group which is a group of, they are anarchists who are organising the mutual aid, and that diversity just made me aware that it was quite difficult to make some overarching claims around what these mutual aid groups are.
Yeah, my point was a fairly simple one. It's not about mutual aid groups, but I know when the organisers set up usually digital forums for other organisers and other workers, there was a huge response. People were really desperate for peer support, basically, and for peer support from other areas so that they could share ideas, and there was nothing formal about that. It was simply somewhere they could go to feel they weren't alone.
Jurgen, you got something?
I just thought I'd pick up on what Matt just said as well, and just take us back to two more questions that sort of appeared in the questions and in the comments section. One from Craig speaking about that the UK government had started mutual aid, or an initiative encouraging mutual aid, in 2012, and one from Ellie saying that, disputing that mutual aid wasn't so much talked about because it's been a particular focus, and she mentioned sort of the 1960s movements then. And I thought I'd just take us briefly back to that, because you've mentioned the anarchists, so we've got Kropotkin in there, but nobody would accuse Lord Beveridge of being an anarchist, and he speaks specifically of activity that is not under the direction of any power of the state. Really a strong separation. This is in the late 1940s. And then we have seen the Thomasina Borgman in the States, very strongly using the term mutual aid in an anti-medical context, where groups get together to support each other without the doctors or psychiatrists or whatever else in particular conditions. I guess what I'm saying here is what Matt already observed. We have quite an unusual alliance of people that have put aside ideology and sort of assembled under a single term, but when we get to start to look at us more analytically, and I guess that's one of the things that we're hoping to look at a bit more, is we need to disassemble that. We need to, and we should not shy away from disassembling that, because what Craig suggests with this, or what Ellie refers to, is part, but is not solely what we're looking at in this particular thing, and I think we need to be conscious of that.
Thanks. So there's an interesting question there, isn't there, about who's calling these groups mutual aid groups? So is the label mutual aid coming from themselves, or is it a label that's been applied to them from the top down in an attempt to co-opt them into a wider kind of government agenda? Mike.
I think one of the interesting questions is how far people are drawing on ideas from outside the English-British experience of the voluntary and community sector. And it'd be one of the things I hope we shall probe in looking at the people, the stakeholders, as it were, in Kensington and Chelsea, is how, there are references to kind of people around the world or something like that. But this is picking up experience and ideas about ways of doing things that come from a much wider scenario than what we're used to talking about in the voluntary sector here.
Marilyn.
Yes, I come at it from a different perspective, which is because I've not been involved in mutual aid groups, but mutuality has been a feature of the voluntary sector, as Beveridge said, since 18th century or whenever. So, and somebody talked earlier about most of our people don't see themselves as volunteers. They associate that with altruism. This is about solidarity. This is about mutuality. So I think unpacking those different perspectives is a really useful thing that the Kensington and Chelsea thing could do.
The slogan for the American organisation Mutual Aid and Disaster Relief is solidarity, not charity, which is quite forceful.
We've got a couple of new questions. So I've got a question, particularly for Jack, but also others. Many people volunteer generally through being asked, and having a connection is a key trigger. Did you feel that mutual aid participants entered into groups through having a connection? Oh, I've lost my question. How bizarre. Yes.
Sorry, I was typing an answer to that as well, just because I wondered if we were going to get to it or not. But
Oh, okay, so that's probably why it's
disappeared
disappeared from my screen.
Sorry.
But, yes, if you'd like to answer, Jack.
Yes, sure. Yeah, it's a good question. And we did kind of have mixed results on that. There was some individuals that were tagged in it on the Facebook page because their friends thought that they would be a helpful resource for the mutual aid group, whereas others were quite independent, I think, in the way that they signed up. They wanted to do something. They were maybe, I don't know, kind of wary of the council response or signing up through the local voluntary organisations. They just wanted to do something. They wanted to do it now and just get things done. Was mentioned quite a lot of the times. But then, yeah, it seems like through the mutual aid groups, they've either built up a stronger network as a result of this. They have a larger connection with the communities that they're in. Indeed, most of the people that we spoke to are they're in the communities already. They have some sort of connection. You go on the mutual aid group page and you would see that you have mutual friends with some of the members. So there's always a level of connection there, and understanding that you're from the same place and having a same community, I think, builds its own sense within that. But then it kind of depends as well. There's some individuals that were part of the mutual aid groups that perhaps voiced some controversial opinions, and that might have made them more isolated as a result of being in those mutual aid groups. So yeah, there's impacts of being part of the mutual aid group, but largely we've seen them to be positive. And I suppose it depends where you're from in the community. I don't know if anybody has been entirely isolated, but that might be another reason to reach out to mutual aid groups as well.
We've probably got time for one more, I guess, kind of brief question, Véronique, if there's anything in the box that you can see.
So there's one question that's just disappeared also, but has been partly answered. So there's a question from James Rees about the mutual aid label that's been applied in the UK. So who created the mutual aid website? I got the impression local groups took inspiration from some sort of single national or international impulse, but I could be wrong. And Mike Locke, you've commented on that. I didn't know whether you want to say a little bit more.
No, I just started answering it because I was trying to find out that as well. I mean, there are these well-organized websites, and I don't know who the people are behind them. And I think that's not just within Kensington and Chelsea where we're looking. I don't think there is kind of like as it were, conspiracy behind it. And I think what Michael and Jurgen were pointing out earlier is the variety of people. But it's still really interesting and curious, I think, why mutual aid should have so easily been adopted as the term.
Did anyone else? Matt, did you have something that you wanted to add?
I think I won't go into it, but I think we've got a bit of a story about what happened in the Bristol region. But I would want to emphasize that we could be missing something that's really interesting, that is about the hyper-local WhatsApp groups and everything that sits underneath that, which in many ways they're more difficult to research because they're not open access groups. But that's where the huge amount of activity has been occurring, and a lot of the people who took part in our work were talking about the Facebook mutual aid groups were sort of higher level repositories for sort of slightly bigger things, but the day-to-day interactions are happening at that street level, and that's where a lot of the more sort of the realities of what's going on can be seen.
That's a really important point. Thanks, Matt. Veronique, is there anything else, or should I start to bring this to a close?
I think Jurgen had his hand up. I don't think there are any more questions.
Go on then, Jurgen.
I promise to be very brief. I guess one thing, if mutual aid, if the terminology is an issue, we need to explore it. But we also should not forget that this is contextual. And I think Cathy put her finger right on it. This is happening in a crisis situation. And yes, this is a unique crisis situation, as all crisis situations are. And we're seeing a particular social development in this context, and we cannot remove it from that. And I think that's an important addition. So it's not mutual aid for the rest of the world and for the rest of time. It's mutual aid in this particular context, and we need to understand why we're calling it that, but we need to know why it's happening. Sorry.
Thank you, Jurgen. I think that's a really important point to conclude on. So, given that we're now 3:30, I would just like to say thanks again to our 5, 6, 7, 8 speakers. We've done, I think, a fantastic job of giving us a really interesting panel. And just to say, this might be the final session of the day, but if you're interested in finding out about the journal Voluntary Sector Review, there will be a session with the editors at 4 o'clock, and everyone's more than welcome to join that and find out a bit more about the journal. Other than that, thanks for joining us, and hopefully we'll see you tomorrow.
Thanks very much, guys.
Cheers, Chris. Thanks.
Bye.